pharmacology or general pharmacology last part, that is adverse drug effects. So adverse drug effects, in the name you can understand, it's like a side effect or an effect which is formed other than therapeutic effect, because normally we give a drug for a person for the case of therapeutic use, but if the same drug which was given for the therapeutic use is causing some effects in a body other than the desired effect, that is called as adverse drug effects. So in adverse drug effects, which mainly includes all kinds of noxious effects like trivial, serious, or sometimes also be fatal. So they are not always like mild, they are sometimes also very serious, and also they may cause the death of the patient. So we should always be very cautious about these effects, and also we should put the patient in a doctor observation if it is severe case. So these are nothing but undesirable and unintended consequence of the drug administration. So this may be side effect due to high dosage of the drug, or maybe due to overdose. So example, here we have the risk of bone marrow depression in the case of our cancer. So in the treatment of cancer, we have a side effect or risk like bone marrow depression, and the mild drowsiness in case of our antihistaminic treatment for cold. For whatever the treatment we take for common cold, they may lead to mild drowsiness, right? So even these small effects are also unacceptable by some kind of patients, because it may lead to some adverse effects. So it may get by using, that is adverse effect, it may get by using any kind of drug for long time, or promptly using, or suddenly we are stopping the drug. So any kind of this, like if you are using drug for long time unnecessarily, then it may cause, and also using it suddenly, promptly, and also by using means adversely stopping it. So this kind of adverse effect we mainly see in our elder people, and also in multiple drug therapy. That is, if you are using one or two more, or sometimes you also use 2 or 3 more drugs, so instead of getting desired effect because of this multiple drug, it may cause also some adverse effects. Now predictable, so it is divided mainly into predictable type and unpredictable. Predictable means, in the name you can understand, like we can predict it. So these are mainly known as type 1 reactions. These are augmented, like they have side effects, toxic effects, drug withdrawal, and most common. And so this predictable type is the most common. So whenever we give a drug, we say that you may have this kind of side effects. So it is like predictable. These are most common, and also dose related, because by increasing the dose or decreasing the dose, we can control it. So it is mainly dose related. Next, coming to the unpredictable. Unpredictable is also known as type 2 reaction. These are the peculiarities of the patient, like here we have allergies, idiosyncrasy. Idiosyncrasy means something related to genes and genetics. So this unpredictable is least common and more serious, because we are not predicting it. So it may be more serious and also require the withdrawal of the drug. So immediately we will withdraw the drug or stop the usage of the drug. So what are the severity? Like it may be minor, moderate, severe, lethal. So minor means no need of therapy. So just by taking mere rest, it is enough. And we also use some antidotes like to prevent this side effect, and also prolonged hospitalization is required if it is minor also, but hospitalization is better because we'll be under the doctor observation. Next, coming to moderate type, here the change in the drug, we may change the drug and we give the specific treatment, or here also we use the prolonged hospitalization for at least 1 day. Next, coming to severe, it is life-threatening, permanent damage may occur, and also intensive medical treatment is for sure required. And lethal, of course, here already the person is indirectly or directly, death of the patient is taking place. So always be careful, don't use over drugs, or don't use drugs which are not prescribed by the doctor, don't have a self-medication. So this may all lead to adverse effects. Next, preventive. So how we can prevent? Avoid inappropriate use, like follow perfect dose, route, frequency, previous history, sometimes allergic diseases, and example like IV administration of aminophylline should be slow, and also require correct lab monitoring, example prothrombin time with warfarin, and serum drug levels with the lithium. Next, coming to side effects. So side effects we can understand it's unwanted, because we give a drug for the therapeutic use, but it is unwanted effect because we don't want a patient to get the side effects. So it's unwanted, unavoidable dynamic effects at the therapeutic dose. So we need to decrease the dose for the treatment. Example like atropine in our peptic ulcer for anti-secretory action, which produce the mouth dryness as a side effect. And acetazolamide is a diuretic, but it promotes the bicarbonate excretion and causes acidosis as a side effect. And next, coming to our promethazine, it is sedation side effect. Normally it is anti-allergic, but it is causing sedation as a side effect. And estrogens are steroid hormones which cause nausea as a side effect. Next, coming to codeine. Codeine is normally used for the cough, but the side effect is constipation, traveler's diarrhea. And sulfonamide is antibacterial, it is causing hypoglycemia, acidosis as a side effect. Next, coming to digoxin, which mainly favors the decrease of AV conduction, but here it is causing undesirable in the case of a congestive heart failure. So next, let us see what is secondary effects. So it is nothing but the indirect consequence of the primary action of the drug. For example, if you suppress the bacterial flora by tetracycline, then the way for the it increases more infections, because the bacterial flora we need for the further development of many useful products and also for the digestion. So whenever we suppress the bacterial flora mainly by tetracycline, it increases more infections. So this is a side effect. If you use tetracycline, we are getting more infections. Corticosteroids weaken the host defense mechanism, like latent tuberculosis is activated. And it's coming to toxic effect. In the name you can understand it is causing toxicity. This is mainly due to the overdosage, because whenever any drug is used overly, it remains, it never gets excreted out, and it remains in our blood or in our systemic circulation. So this leads to toxic effects, and also due to prolonged use, of course. So this overdosage may be accidental, like not someone you only have put extra dose, and also homicidal, someone is giving to you intentionally to kill you, and suicidal, like the self, we know that. So increased atropine may cause delirium as a toxic effect, and paracetamol if you use more, it may lead to hepatic necrosis as a toxic effect, and gentamicin if you use, it may lead to renal failure mainly. Gentamicin cause toxic effect. And CNS, CVS, kidney, liver, lungs, skin, blood, all these blood forming organs, all these are most common in the case of toxicity. Next, extended therapeutic effect, that is for therapeutic use only, but we are extending it, then also it may cause toxicity. Example, coma by barbiturates, complete AV block by digoxin, and increased morphine leads to respiratory failure, and bleeding due to heparin, and emetine causing myocardial damage, streptomycin causing vestibular damage. So all this. And next, poisoning, mainly large dose of drug may also lead to poisoning. Specific antidotes and receptor antagonists are used, and chelating agents or specific antibodies, and emesis syrup, ipecac, apomorphine injection, or gastric lavage is used mainly for ingested poison. So again, for this poisoning also we are using drug to prevent this or to reduce this poison. And to prevent the poison absorption, we use 20 to 40 grams of activated charcoal along with the 20 grams of water. And we have a universal antidote, that is to prevent poisoning, is burnt toast along with strong tea and the milk of magnesia. These three should be in the ratio of 2:1:1 ratio. So charcoal alone is best when compared with this universal antidote, because charcoal prevent the absorption of the poisonous drugs. And increase excretion by diuresis, because now we have took the drug, it should easily come out so that it may not cause any poisoning. Here we use fluorescein, mannitol, which mainly alter the urine pH and let the poisons get out. And alkalization of acidic drugs, example you have barbiturates. Acidification for basic drugs, example amphetamine. And hemodialysis along with hemoperfusion is more efficacious procedures. And next, let us look at intolerance. So intolerance is a toxic effect at the therapeutic dose, same. And we use here some people fall on the left side because of Gaussian frequency distribution curve for sensitivity of the drug. So everyone have specific sensitivity for the drug. So example, you can take the single dose of triflupromazine. It causes muscular dystonia in children mainly. And few doses of carbamazepine cause ataxia in some people. And 1 tab of chloroquine cause vomiting, abdominal pain in occasional patients. that is in few patients. Next, let us see this idiosyncrasy. It is genetically abnormal reaction to the chemical. So it is uncharacteristic and it has some bizarre effects which are seen mainly. Example, barbiturates cause excitement, mental confusion, and quinine or quinidine cause cramps, diarrhea, purpura, asthma, and also vascular collapse. So many side effects for quinidine. So like this idiosyncrasy means for specific genetic people with specific gene people, it causes this kind of side effects. And next, coming to drug allergy. It is immunological reaction, mainly drug hypersensitivity it is dependent on, and latent period is about 1 to 2 weeks. And here the drug antigen like hapten is hapten is incomplete antigen, it induces an antibody. So sensitized lymphocytes are released, which are mainly. This drug allergy is variable in different persons because here the immunological reaction is taking place, because for some people it may be allergic and some people it will be normal. So this is further divided into humoral type, cell mediated type, and we have mainly 4 type of hypersensitivity reactions here. Let us look at them each. So first, type 1 hypersensitivity reaction, it is the anaphylactic reaction where mainly IgG antibody which is present in the mast cell plays an important role. So here first the antigen antibody reaction takes place in the mast cell surface, and serotonin, LTC4, D4, PG, prostaglandins, PF, all these factors are released, and they cause mainly urticaria, itching, angioedema, asthma, rhinitis, anaphylactic shock. So if quick immediate hypersensitivity reaction, then antihistaminic drugs are used for this situation. Next, coming to type 2 reaction, this is a cytolytic reaction. Here the drug acts with the specific tissue cell as an antigen. So IgG, IgM play the major role as antibodies here. If you remember here, IgG play an important role. Antigen antibody reaction takes place and cytolysis occur. So examples you can take thrombocytopenia, agranulocytosis, aplastic anemia, hemolysis, organ damage like liver, kidney, muscle, systemic lupus erythematosus, right, SLE, etc. Next, coming to type 3 reactions. These are circulating antibodies like IgG. So here antigen antibody reaction takes place at the vascular endothelium. Inflammation response is produced, which like rashes, serum sickness, fever, mental symptoms, and subside within 1 to 2 weeks. Next, coming to cell mediated type 4 reactions. Here T lymphocytes, receptors for the antigens, and the lymphokines attract the granulocytes, and inflammation takes place, forms dermatitis, rashes, fever. So photosensitization reaction takes place greater than 12 hours, and the treatment for allergies mainly immediately we need to stop the drug. For anaphylactic shock or also angioedema, and for larynx, adrenaline 0.5 mg is injected subcutaneously along with antihistamines and glucocorticoids. Remember that glucocorticoids is used for all types like type 2, type 3, type 4 reactions, and skin test we do by intradermal like patch test, and also intranasal for 4-1 in type 1 reaction but not for others. Remember that 4-1 is done only in type 1, and glucocorticoids is used as a relief for the allergy or any sensitivity reaction for mainly type 2, type 3 and type 4 reactions. So sometimes this may be false positive or false negative also. It is not rare, means it may give some wrong results, we may can't completely depend on them. Next, coming to photosensitivity. It is nothing but a cutaneous reaction where the drug is induced the sensitization of the skin to the UV radiation. So any drug which is given and it is acted upon by UV radiation and causing photosensitivity. So phototoxic drug or metabolite in the skin increases along with light. They react to form the photochemical reaction and also photobiological reaction, local tissue damage and sunburn like symptoms like erythema, edema, blisters, and also leading to hyperpigmentation. So here the UV light is mainly in the shorter wavelength about 290 to 320 nanometers in photosensitivity, and acute phototoxic reactions like tetracyclines cause demclocycline tar products, and chronic low grade sensitization, nalidic acid, fluoroquinol, sulfones, sulfonamides, penothiazines, thiazides, amiodarone, most common than photoallergic reaction. So what is photoallergic reaction? Remember that photosensitive reaction is by short UV rays, and this is more common when compared with photoallergenic. It is using longer wavelength of UV radiation, that to UVA 320 to 400 nanometers, and it is cell mediated response. It produces eschematus dermatitis like symptoms like flares, and here the drugs are sulfonamide, sulfonyl urease, grisoflin, chloroquine, chlorpromazine, etc. Next, coming to drug dependence. It mainly many of them depend on the drugs, and if they are not using, they may be altering the mood, feelings. They have some euphoria like condition whenever they use drugs, so they feel that if they don't have drug they can't live, so they are mainly dependent on the drug. But it is very risky to the health, because if you withdraw this drug again, withdrawal symptoms, all those will take place. So withdrawal from reality and social adjustment. And next, what is psychological dependence? This is also same like drug dependence, like they psychologically fixed to the drug, that only by using this drug their desire is formed, like opioids, cocaine and benzodiazepine weak the reinforce. Fast drug acts more reinforcing. Fast drug means which are the drug which is acting fastly, it means it is having more chance of addiction. We need to use it more again so that they get a euphoria like feeling in the case of psychological dependence. Next, physical dependence means by repeated administration, sometimes if they discontinue they show withdrawal symptoms. It is also having neuroadaptation, like they completely adapted with the nerves of the drug, so it is nerve related, and there are lot of they can't live without the drug, like exopioids, barbiturates, depressants, alcohols, benzodiazepines, stimulant drugs like amphetamine, cocaine. So all this, and drug abuse, we know, like self-medication of illicit drugs, we know this all drugs, nonsense drugs, right? They are not for therapeutic use. So in the drug abuse only, in the name only can understand. Next, come to drug addiction. Yeah, overwhelming use of amphetamines, cocaine, cannabis, LSDs, naloxone, etc., alcohol, everything. Next, drug habituation means there is mild discomfort only in the withdrawal. It is not so much habituation, like tea, coffee, tobacco. So these are also better to be avoided, because they are also in a section to read that it is habituated, right? So next, drug withdrawal reactions. Its adverse consequences: acute adrenal insufficiency. So in this case, what happens? If we withdraw, in this case, adrenal insufficiency by stopping of corticosteroids, and increased BP, sympathetic overactivity if we stop clonidine, and worsen angina and pectoris and myocardial infarction if we stop the beta blockers, and increased seizures, increased withdrawal of anti-epileptics, adaptive changes minimized by gradual withdrawal. So whatever may be in therapeutic drugs or illicit drugs, they should be withdrawal in very slow manner so that they will not show any withdrawal symptoms. What is teratogenicity? Drugs which are used by pregnant female whenever she is carrying a fetus, this causes teratogenicity, so fetal abnormalities in a pregnant woman. So we know the famous drug thalidomide causing a disaster. 1,000 babies are with phacomelia, they seal like limbs, that is their middle part is not present, the lower part of our arm is directly attached with the trunk, so that is the phacomelia. Mainly when a pregnant female should avoid the drugs, mainly during fertilization or implantation type, because conception up to 17 days they fail to pregnancy and it is unnoticed. And organogenesis, because all organs start forming about 18 to 55 days of gestation, so it is most vulnerable if we use drugs during this time. And growth and development about 56 days onwards, because development of different organs, everything takes place, so we need to not take drugs during this time. It's better to avoid drugs by pregnant female, and all over, if necessary only she need to use. Next, coming to carcinogenicity and mutagenicity, it causes cancer. That drugs are causing the cancer and genetic defects, and also oxidation of drug leads to reactive intermediates, affects the genes and structural changes in the chromosome. So here we have chemical carcinogenesis, which takes place about 10 to 40 years to develop, and here we have anti-cancer drugs, radioisotopes, estrogens, tobaccos, which mainly causes chemical carcinogenicity and mutagenicity. Next, coming to drug induced disease. This is known as iatrogenic, that is physician induced disease, that is by doctor only this disease is caused by giving the drug. So it is functional disturbances by drugs like persist even after we stop the drug, and it is largely eliminated. Example for peptic ulcers, salicylates and corticosteroids, Parkinsonism by phenothiazine and other antipsychotics, hepatitis by isoniazid, and DLE by hydralazine. So these are the examples, and in our textbook actually refer KD Tripathi. So in our textbook we also have some teratogens list here, like which drug cause which abnormality, like thalidomide called phacomelia multiple defect, anti-cancer drug cause multiple defects, fetal death, androgens called viralization, limb esophageal cardiac defects, progestins viralization of female fetus, and stilblo-estrol vaginal carcinoma in teenage female offspring, and corticosteroids cleft palate and lip and cardiac defects, tetracyclines discolored deformed teeth, retarded bone growth, warfarin nose, eye, hand defects, growth retardation, phenytoin, hypoplastic phalanges, cleft lip or palate, microcephaly, phenobarbital, various malformations, carbenzapine, neural tube defects or other abnormalities, valproate sword, spina bifida, other neural defects, lithium fetal goiter, cardiac and other abnormalities, antithyroid drugs, fetal goiter, hypothyroidism, iodomethacin or aspirin, premature closure of ductus, arteriosus, isotretinoin, craniofacial, heart and CNS effects. So this is just to memorize, revise many times, we'll remember it. So that's it all about adverse drug effects. If you like our video, please like, share and subscribe.